if you would please welcome Dr. Nupura Bakshi.
Thank you, everybody, and thanks to the Foundation Fighting Blindness for having me here today. So this session is pretty much ask whatever you want. There's no dumb questions. Feel free to ask anything at all. Maybe you wanted to ask your doctor and you got put out of the room too quickly and you didn't have time to ask, so you can ask me now. So just raise your hand and I'll come around with the microphone.
Dr. Bakshi, I would like to ask you about vitamins recommended for RP.
Mm-hmm. So this is a great question. So vitamins for RP, so that's what the person there was asking. So essentially there was a big study in 1983 looking at vitamin A in patients who had typical retinitis pigmentosa. And that study showed that 15,000 international units, which is like a very, very high dose of vitamin A, was shown to reduce the rate of progression of the RP by 2% per year. But it can cause problems with the liver. And so people needed to have liver testing done and also vitamin A baseline blood work done. Now, since 1983, there haven't been, and that was a long time ago, there haven't been any huge studies. The same group that did that study did another study saying if you're taking vitamin A or you're about to start it, does adding omega-3s, like having a 3-ounce, I think, serving of oily fish twice a week, did that help? And they said that if you're already on the vitamin A or you're about to start it, the omega-3s also, there was an additive effect. So having 2 servings of 3 ounces of fish, one 3-ounce serving of fish twice a week was protective. Now, since then, we've also had some other things that showed that depending on what your genetic mutation is, that some patients who have RP have a mutation where vitamin A can make you worse. And so this is the reason that we don't always recommend vitamin A in high doses for people who have RP anymore. And so a lot of people who have RP who get the genetic testing and their testing doesn't show those genes, it just shows the kind of more common ones. Certainly they're welcome to take the vitamin A, but knowing that they have to have their liver tested and it can cause liver problems. But we do usually recommend like dietary intake just from, green leafy vegetables, colorful fruits and vegetables, having a well-balanced diet and having 2 servings of fish a week.
Just an addendum to that question. The vitamin A pills are measuring 10,000 micrograms. Is that
15,000 international units.
15,000, okay. Is that considered to be safe dose?
It's a very high dose.
It is high.
It's considered to be a high dose. That's why you have to have blood work done while you're on it. And again, I don't routinely recommend it to my patients unless I know that they have like typical RP and we know what their mutation is. Because again, there's a risk that maybe, we don't know, maybe it could make it worse. And it hasn't been retested in any way since 1983.
Validity of zinc and the dose.
So zinc, the main evidence for zinc is in macular degeneration and not so much in retinitis pigmentosa. Really the things that have been studied in like a good way for retinitis pigmentosa are vitamin A and omega-3s.
Vitamin E? No.
Mm-mm. Vitamin E, no. They say avoid vitamin E because that same study from 1983 showed that vitamin E couldn't make things worse. So again, this is not, don't everybody say, oh my God, I can't eat something in my diet that contains vitamin E. Have a healthy diet, a balanced diet. This is all talking about extra supplementation. And again, just like I was saying in my other talk for AMD, diet is the most important thing. There's no pill that's going to substitute for a poor diet. So this person's asking, my eyes get wet with tears when I go in and out, like from inside to outside. Is that what you mean? So the tear it comes from the front part of the eye and is unrelated to any retina problem that you may have, genetic or otherwise. And so the reason that people tear is one of 2 things. Either they're making too much tear or their tears are not draining properly. And so the most common reason is that you're making too much tear because the tears that you have right now are not coating the surface of your eye properly. And so when you walk out into the wind or the cold, the surface of your eye gets irritated and you make more reflex tears. So there's several different ways that this can be helped, and you can certainly talk to your doctor about it. And it's usually using warm compresses and keeping your eyelashes clean and putting in teardrops so that your eye doesn't make extra tears. So that's if you're making too much. If your tears aren't draining properly, that can happen because as you get older, the pathways where the tears drain from the eye to the throat get narrowed as the bones get thicker. And so that really is only fixable with surgery, where they go in and make a new pathway, and that's pretty involved. But you can have that tested with your doctor to see, is it that you're making too much tears or the tears aren't draining properly. But tearing when you go from inside to outside or different weather conditions, or if it's dry, this is very, very common with aging.
I'm just trying to figure out the good and the bad for RP, and one of them is exercise, get more blood flow. I don't know anything about acupuncture, but is that something that's been known to help as well? Or?
So, I mean, in my personal opinion, I don't think acupuncture can hurt, but we don't know if it helps. Again, there's a lot of things in complementary medicine and alternative medicine that don't get studied in a rigorous way, like a big clinical trial or whatever, for us to be able to universally recommend them to patients. Certainly we know there are studies for acupuncture in other parts of the body and other diseases, in neuromuscular disease, and we even know it helps fertility and it helps dry eye apparently. And those have been studied. For genetic eye disease, we don't know. I certainly have several patients who do it and they feel that their vision is better, but we don't have a scientific answer.
I have two quick questions. So I went to Mount Sinai and did my genetic testing. I got my results. Where can I find more information? Kind of follow up to the lady's question. I actually stopped taking vitamin A because I heard about this vitamin A could cause RP to progress. So if I know my results, can I Google? And
you would just take it to your doctor and discuss the results directly, and then they'd be able to tell you that.
Okay. Then my second question is, when I had my cataract surgery, my doctor warned me that there could be a potential to increase or to progress the RP. So how much time frame should I expect I would have increased loss of vision?
So the risk with cataract surgery is not really known. There hasn't been a study that showed that, cataract surgery makes either RP or macular degeneration or anything worse. The thing that can happen after cataract surgery is that people can develop swelling in their retina, which also can occur in retinitis pigmentosa as well, separately. So one of the things we worry about is somebody with RP more likely to develop swelling in their retina after cataract surgery because they have a predisposition towards it to begin with. But that's usually within the first couple of months after surgery. So once you pass that point, it's unlikely for something to happen.
Just to add on to the cataract question, excuse me, I had cataracts in both eyes, had one removed, but did not know I had RP yet. And it was a disaster. So I would consult with the best if you're thinking about cataract surgery if you have RP. I did not know, and now in hindsight, I would not have had it done.
Actually, Dr. Mandel was my specialist, and my case, my RP is a different form. In fact, I had my cataract, my vision has improved dramatically. So, but I do know that my right eye now, my retina has swollen, and he has been trying to keep it down.
Yep.
And so I'm not sure whether I'll have to do eye drops forever.
So it is hard. Yeah, often people if you develop the swelling, you do often need to go on the eye drops for several months to even over a year for the swelling to go away. I would say in most patients who have RP, other than the patients, I would say most of my patients, maybe because I'm also a retina specialist, are diagnosed with the RP prior to their cataract surgery happening, and we certainly have a lengthy discussion about the risks and benefits at that time. It would be unlikely for me to diagnose it only after. That's only if their cataract was so huge you couldn't see the back of the eye, and that's very rare. But I would say if the patient is correctly, has informed consent, and you're choosing the right people to have surgery, most people do very well after cataract surgery.
Oh, I had a question about fish. You mentioned oily fish are very good to eat. What kind of oily fish or fish in oil?
So I have a list. I'm a vegetarian, so let me just tell you what it says. Right, so cold water oily fishes, salmon, herring, mackerel, anchovies, and sardines. I don't know myself. I've never eaten fish before, but and also that's why I also made a comment in the other room about if you are vegetarian that the fish get it from algae. Actually, that's the original source. So if you take like an algae oil, that's equivalent to eating the fish, and you won't have the fishy burp.
Microphone got here really quickly. I was going to ask you if you don't like fish or you don't. I can't stand fish.
Right.
What, an algae oil?
Yeah.
Where would I?
You can get
find
that at any natural food store. Like it's essentially like, there's a brand that's like called, the one that I know of, there's one that's called like Nutricy, but that has the fish oil, and that same company makes the vegetarian one that's just algae oil. But it's hard to get it like, say, Shoppers Drug Mart, but you can get it at Whole Foods and a natural food, any kind of natural pharmacy.
How much would you take?
It's usually right on the bottle. It's like 1 or 2 teaspoons a day or whatever. If you take flaxseed oil, that's also a source of omega-3s, but the rate of the ALA, which is what's in flaxseed, how much of it gets converted to EPA and DHA is less. So flaxseed is a much lower source of the direct omega-3s that are studied. So the algae oil is the stronger source.
My son was just diagnosed with Stargardt's disease. In fact, we just got the genetic testing back on Thursday, very timely. With Stargardt's disease, I know that when they noticed the macula, the pigmentation was beginning to change, they recommended vitamins, but we haven't had any discussion about vitamin therapy since the clinical diagnosis was made in August. So is there something that I should be doing?
Well, it's, more like something you shouldn't be doing. So you wouldn't want to take a vitamin A supplement when you have Stargardt's, because those are the mutations, that spectrum of Stargardt's mutations. If you have the ABCA4, AR probably is the mutation that your son may have, that the vitamin A supplementation increased the rate of progression. Okay. So certainly, again, this is not your diet. Don't worry about eating carrots or something else that contains beta-carotene. This is talking about a supplement. So probably when he was first looked at, they didn't know exactly what it was, and oftentimes people will think it's maybe macular degeneration, so start taking the supplement. But that's certainly an important distinction between a retinal dystrophy or a macular dystrophy, a genetic macular disease, and macular degeneration, and what we recommend in terms of supplements is different. So for my patients with Stargardt's, I tell them to avoid an external source of vitamin A, like a pill, but they should certainly, and really the diet is the most important thing, that they should still have a well-rounded, healthy diet with lots of antioxidants and fruits and vegetables, and the 2 servings of fish a week.
Okay, and then I guess, I don't know if you can answer the second question. With the genetic testing, how far do we take that out in a family?
So
because they've given us the availability of the testing for
right. So
sibling.
it's autosomal recessive. So meaning that it's not like somebody in every generation is going to have it. So it means you and the father of your son are carriers for it, and then that he has it, and then if there are other siblings, if they're unaffected, then they may also be carriers for it. So it really depends if his brothers or sisters wanted to know if they were carriers, so they certainly could be checked. But because it's autosomal recessive, if you don't actually have any symptoms of it and your eye is totally fine, the likelihood of you passing it on and having an affected child is really if you happen to incidentally have a child with somebody who is also a carrier. Right. And if you're not, marrying, or not, sorry, people don't have to get married these days to have kids. If you're not having a child with somebody within your own same community or ethnic background, it's far less likely.
Yeah, so it doesn't have to go out to cousins.
If they want to, they certainly can, but it would be.
But the likelihood is much,
yes,
infinitesimally
yes,
smaller.
very tiny.
Right. Okay.
It would really be for maybe brothers and sisters.
Right. Okay. Thank you.
So, doctor, would you recommend any vitamin supplement for RP patients then?
So as I said, I only recommend it once the genetic testing is done, and even then it's really a risk-benefit ratio. If people have any liver problems, or if they're pregnant or breastfeeding or contemplating pregnancy or anything like that, I say no, don't take it, and they'd have to make sure that they have their liver checked with their family doctor, and that would really be regarding the vitamin A. And but I think omega-3s is the easier recommendation because there's not a big worry about toxicity, and your cardiologist recommends it for your heart, and family doctor recommends it for general good health, so that I think is the easier recommendation, but I always recommend diet first.
So my son has a genetic eye problem called achromatopsia with genes C and G8-3. So I want to know, is there in his diet, should we add something? Should we subtract something from his diet? What's helpful for him?
Yeah, so we don't have any evidence for achromatopsia, so I wouldn't say, take a particular supplement. It really would be dietary. Like the general thing is that's good for safe for everybody. Lots of green leafy vegetables, lots of colorful fruits and vegetables, berries, antioxidants, and either the omega-3 or the 2 servings of fish a week, protecting his eyes from the sun. And I mean, I'm hoping he's too young to smoke, but don't let him get into that.
Hi. My mother has RP, and none of my siblings have RP. Now, with my husband, if we had children, what are the chances of them getting the...
Have you guys had genetic testing, or has your mom had genetic testing? You have. And do you know the gene or the inheritance pattern?
Figuring it out.
They're still figuring it out. So it really depends on how it was inherited and how you could be a carrier, for example, you don't know. RP, there's like 90 plus genes that are involved, and it can be inherited in every single way. Unlike, say, Stargardt's, which is often one, like the vast majority of people have one way of inheriting it. RP can be inherited in 1,000 different ways. So really for you to know would be once you have the results of the genetic testing from your mom, then you'll have an idea of how is that gene transmitted. And certainly your whole family can go for genetic counseling together so that you can get an idea from the genetic counselor based on all the history in your family, previous generations, and et cetera, to know how it's inherited. And then that's the only way you would know what your risk was.
And we can do that through our family doctor.
So you would probably, your family, any doctor can refer you for genetic counseling. There's probably a few centers, are you guys in Toronto? Or so there's a genetic counseling at Humber, at Mount Sinai, and also at Credit Valley. Those are the 3 places that I know of that are more familiar with doing the genetic testing for eye disease. And that you would meet with a genetic counselor, and they would discuss answer your exact question. But they'll have much more information once they know what your mom's gene is.
Hi, so I have been tested, and my brother has retinitis pigmentosa, and I am a carrier of the gene. So I was just wondering what my options are in terms of, I know it's kind of a game of chance, but I don't know, amniocentesis, or is there anything like that I can do?
That's a great question. I mean, there are options for prenatal testing. It's much more common for Down syndrome or a big disease like that than something that's very specific for the eye. But yes, you would certainly speak with your OB-GYN at the time that you were contemplating pregnancy or becoming pregnant to see if there were ideas for prenatal testing. But if you're a carrier, again, the likelihood of you having an affected child would be pretty small unless you happen to also have a child with somebody who was a carrier. Because you yourself are fine, right? You're not affected. Yeah.
You were talking about the retinal swelling with the cataract surgery. I didn't quite catch all that. Is that a swelling that goes away, or is that?
So anybody who has retinitis pigmentosa can develop, or even other retinal dystrophies, but much more common with RP, they can develop macular edema, which is swelling in the retina. And the mechanism of that is a little bit different. You can develop macular edema in 100 different diseases, but the mechanism of a genetic disease is a little bit different. Anyone who's had cataract surgery can develop macular edema as well. It just occurs because of the inflammation in the eye after surgery. So somebody who has RP, who already has a tendency towards maybe having some leaking in the retina or some swelling in the retina, is more likely to develop it after cataract surgery for that reason. So it essentially, you would notice it because maybe your vision wouldn't be as crisp as you expect after surgery, or the vision could go down a little bit. And then the doctor would do a scan of your retina called an OCT scan, and they would see these little cysts in the tissue in the macula at the back of the eye. And then in standard cataract surgery patients, it's often just treated with eye drops, and that's often the way we treat patients with RP as well, but they may need some extra drops. And sometimes in patients who have RP, it's both a combination of the RP causing it and the inflammation from surgery.
So does it go away with the eye drops?
Yeah, it usually goes away with drops.
So it's not a big enough concern to not do the surgery?
No. I mean, certainly, some people who have RP and never have had cataract surgery have swelling in the retina. So if somebody has a ton of swelling in the retina to begin with, then that would be a bigger concern for cataract surgery. But if that's not the case, then I certainly would not have the surgery because of that.
Okay. If I may ask another question. We're talking about genetics, and if I had Usher's, can children develop RP and not show the hearing aspect?
There's a variable degree, although sometimes people cannot show any hearing problem, but when you do the hearing test, there's like a subtle degree of hearing loss. So the main thing is really to get checked. So have the eyes checked and the ears checked, like have a baseline audiology assessment just to make sure. Because even if somebody doesn't show any signs of hearing loss, that doesn't mean they don't have a subtle degree of hearing loss.
Okay.
Or they might just have selective hearing, like when their mother or their wife calls them. But
I'm going to ask another question.
Yeah.
Sorry, when we were talking about the genetic testing and you were talking about amniocentesis, my son, who was just diagnosed with Stargardt's, also has Down syndrome.
okay.
Where is the best place in Toronto to have him followed medically, would you say?
For the Stargardt's, you mean, or for
the combination of the two things? I mean, I know
How
they're
old is
both-
he?
He's going to be 28 in 3 weeks.
That's a good question. So to have him followed, you mean by an eye doctor, or do you mean for his medical health or for the genetic testing, genetic counseling part?
Well, the genetic counseling, I think we've got it.
You've gotten it. It's all done.
Yeah, it's all
Or-
done.
okay.
It's all done.
So probably the best person to see, I would say probably outside of, I mean, now sick kids won't take any adult, like people who are over the age of 18, even if they're developmentally delayed. So that's that would have previously probably been the best place. So I would say probably a community ophthalmologist who sees adults and children both. So because they'll have depends on his cognitive ability, but if he's more impaired, then certainly somebody who is more comfortable with children would be able to better care for him, I think.
Right, because there's just an added sensitivity. I mean,
Absolutely.
doing the ERG test was very
Right,
challenging
right.
for St. Mike's. It was
Yeah.
very challenging
so
to get him through
if you come up
that.
to me after, I can give you some specific names.
Okay, thank you very much.
I had another question about the vitamin A. You said the 15,000 international units was considered a high dose. Is that something that is recommended if you know you have the gene but are not yet affected, or is it something that is when you're starting to experience symptoms?
It's only recommended for patients who have, well, it's not even globally recommended for anybody. But based on those studies, it was recommended for people who had typical RP who are already experiencing symptoms of vision loss.
If you do not have symptoms yet, but you know you have the disease,
Yeah.
what would be
A healthy diet, omega-3s.
okay? Because vitamin A was recommended to me, but in a very low dose. So I was
Yeah,
just
so we
thinking,
don't
is
know. We don't know. The only dose that was studied was the higher dose. So does the lower dose help or not? We don't know.
That study of high-dose vitamin A was done by Dr. Elliot Burson, was it not, in the 80s? Yes, I'm
Yes.
familiar with it, and I've seen him, but much earlier, well, previous to that. I don't know what the dose was, but I know it was high, and the concern was the toxicity to the liver,
Yes.
right? But it did show reversal of vision loss.
It was mostly that it slowed a progression. It prevented further vision loss by 2% per year.
I thought it quoted some patients who actually gained vision.
Yeah, so there was the main statistically significant result was the reduction in that was their primary endpoint of the study.
For me personally,
Yeah.
I did have genetic testing. I think it was non-specific. I don't think there was any gene identified.
Right.
And I am taking vitamin A, 1 capsule a day. I haven't noticed any improvement or deterioration. I mean,
Right.
I do have very little vision left anyway. So I guess my question is leading to that. I don't know if I'm helping or hurting. You recommend not to take any.
No, it's not that I recommend not to take it. If you've had your genetic testing and you're medically well on it, or you have typical RP, like your doctor could tell you this, if you have typical RP, like in that Dr. Burson study and all the studies since, anybody who has atypical RP, meaning it doesn't look like the 100% textbook classical version, they don't recommend it because the worry is that they could have one of the genes where maybe it doesn't help. So your doctor could tell you what category you kind of fall into. If it's not hurting you, you've been on it for a long time, I don't see any harm in taking it. I mean, you could also try drug holiday and see if you stop it, if it makes any difference to you.
Thank you so much.